Good morning, everybody. Thanks for joining us for our 5th WISE Coalition for Healthy Children Summit. I'm Lauren Purvis. I'm the program manager for the Child Wellness team here at the Center for Children's Health. Please be aware that this session will be recorded and made available through website and social media links to inform and educate the public on this topic. At the end of today's summit, we'll have a facilitated discussion with our Center for Children's Health team. You will be invited to unmute yourself to ask questions, or you can type your question in the chat box. Keeping that in mind, if you choose to participate in an identifiable way, you acknowledge that your image and/or name will be recorded and are authorizing the use of your information in the recording as described. You have no obligation to appear or speak in the recording, and you can turn off your video and participate under a different name should you wish to remain anonymous. The recording of today's summit is protected by copyright law and is not to be copied. And if you feel comfortable doing so now, please turn on your video at this time. So I'd like to start off by thanking our elected officials for joining us today. I know we have Judge Clark on the call, and then Colleen Self, who's the Chico City Mayor. And I'm not sure if we have Justice of the Peace Jan Morrow on the call, but I'd like to welcome you all today and ask if there's anyone that I have missed. So for today's agenda, Becky Hale, the Director of Child Evaluation for the Center for Children's Health, will kick us off with the Cook Children's Commitment. And then the Honorable J.D. Clark will provide our formal welcome. And after that, we will hear about Cook Children's efforts to improve children's health in the region. Then we'll receive an overview of the WISE Coalition for Healthy Children to learn how we're improving children's health locally. And then a highlight of the day, we'll be learning about the results from our most recent Community Health Needs Assessment and how WISE County children are doing in the following topics: healthy lifestyles, mental health, and parenting support. After the data presentation, we will take a short break before the award presentation. And after the presentation, there will be a 15-minute facilitated discussion, and then we will finish up the day with a call to action and closing remarks. So with that, I'd like to introduce Dr. Becky Hale. Becky serves as Director of Child Health Evaluation in the Center for Children's Health. Her team oversees the research aspect of our Community Health Needs Assessment, evaluation efforts for the programs and coalitions led by the center, and various reporting endeavors to both internal and external audiences. Becky has worked for Cook Children's for a little over 10 years and recently completed her doctorate in education, with her research identifying the overlap of community-based strategies addressing tooth decay, obesity, and asthma among children and their families.
Thank you, Lauren. Next slide, please. All right, Cook Children's is committed to serving the children and families in our communities, and we are very excited to bring you results from our most recent Community Health Needs Assessment today. This assessment is one of the many ways that we fulfill our system's promise. Knowing that every child's life is sacred, it is the promise of Cook Children's to improve the health of every child through the prevention and treatment of illness, disease, and injury. In light of today's event and our needs assessment, I would like to thank the leadership of the Center for Children's Health, Chris Pedigo and Marilyn Napier. I would also like to recognize the work of the Child Health Evaluation team in overseeing the needs assessment research process, as well as Courtney Bernard, Lauren Purvis, and Jamie Josephson in the planning and coordination of our summit today. At this time, I will turn it over to Jamie, who will continue with our agenda.
Thank you, Becky. I'm Jamie Josephson, Program Coordinator for the WISE Coalition for Healthy Children. Our first speaker, the Honorable J.D. Clark, is currently serving his second term as County Judge of WISE County and was recently reelected to a third term. He holds a bachelor's degree in English and History from the University of North Texas and a master's degree in Educational Leadership from Midwestern State University. Prior to his 2014 election as county judge, Judge Clark was a high school history teacher and the mayor of his hometown, Chico. Judge Clark currently serves on the Texas Association of County Board of Directors, the National Association Counties Board of Directors, the Texas Library and Archives Foundation Board of Directors, and the Wise County United Way Board of Directors. Judge Clark's current focus in Wise County is honoring the past and building the future, a vision based on infrastructure service development for current and projected growth, while also restoring the 125-year-old working courthouse and preserving local history. Judge Clark and his wife Leah live near Chico with their 3 daughters, 5-year-old Claire, 3-year-old twins Maggie and Zelda. Welcome, Judge Clark.
Thank you so much, and good morning, everyone. I'm honored to be here and welcome you all to the 5th Wise County Child Health Summit. We're excited to see your faces here today and be able to get together for this important discussion. As many of you know, this journey began back in 2009 when Cook Children's conducted an assessment of children's health in Wise County. In 2011, community members from across Wise County came together and created the Wise Coalition for Healthy Children to focus on improving the health and well-being of children in this county. From the CHNA results, stakeholders identified parenting support as the primary health focus for the coalition. Healthy children and healthy families are the cornerstone of a strong and vibrant community. And as Wise County grows, so do our challenges and our opportunities as we work to address children's health issues. These conversations and initiatives are so important. And I thank the coalition members and our community partners for your dedication to improving the health of children and families in Wise County. A special thanks is due to Nicole Rosenbaum, the present chair, for your ongoing leadership of this coalition. And once again, thank you all for joining us today.
Thank you, Judge Clark. And Becky, you want to lead us into the data presentation?
Absolutely. All right. Well, thank you, Jamie. As we begin the data presentation, I would like to highlight what a collaborative process our assessment has been this time around. I'll share an overview of our assessment methodology, along with a few more specifics with our parent and community leader survey demographics. And then our own Blair Williams will jump in and present the data results for Wise County. Next slide, please. All right, I'd like to first pause and recognize our numerous supportive community and research partners. I'd first like to thank you all for attending this event today. I know many of you helped share information about our parent surveys with the families in Wise County and completed our community leader survey or participated in an interview. So thank you for your support in this endeavor. Thank you also to Linda Fulmer, our CHNA administrator. A big thank you to our research vendors who provided their expertise in collecting the data, ETC Institute, MHMR of Tarrant County, UNT Health Science Center School of Public Health, and the Center for Transforming Lives. I'd also like to thank the many internal departments within Cook Children's who have been very supportive of our CHNA journey. And then for this assessment, we brought together an external advisory committee made up of community partners representing the 8 counties within our service area. These partners met July 2020 through August of 2021, and these individuals shared their time and insight with us as we were finalizing our parent and community leader surveys. They also created awareness of the surveys during data collection, and some provided interviews. We had representation from all 8 counties on this committee, and I would like to thank Kim Dunlap, Robin Garrett, and Deanna Ochoa for representing Wise County on this committee. We greatly appreciate their involvement and expertise. Next slide, please. All right, we expanded our methodology for our 2021 Community Health Needs Assessment. We conducted a household survey of parents and caregivers of children 0 to 17 from all 8 counties within our service area. And it's really important to note that this parent caregiver survey provides us with information from the parent's perspective, which is really insightful. But we also know it's just one piece of the puzzle. And so for that reason, we include additional methods of data. We held face-to-face interviews with families experiencing homelessness or with an undocumented member. We held virtual focus groups with families to gain a deeper layer of understanding around the barriers to access to care, COVID-19, and other prevention topics. We conducted a community leader survey with more than to gain a deeper layer of understanding from their perspective. And then we also held interviews with more than 20 leaders for more insight from their particular community. And then finally, we reviewed local, state, and national data to fill in any gaps, look at trends or benchmarks, or provide additional insights. I'd now like to play a short video providing a brief overview of of this methodology.
Maintaining good health for North Texas families is not always easy. Many families face obstacles such as poverty, discrimination, quality education, housing, and unsafe environments. Addressing these hurdles requires a community-wide approach with a shared goal: healthy children. Everything we do at Cook Children stems from the promise we've made to our communities to improve the health of every child through the prevention and treatment of illness, disease, and injury. One way we keep this promise is through our Community Health Needs Assessment. Every 3 years through this assessment, we hear from parents and community leaders throughout North Texas. The valuable data revealed in this assessment becomes a shared rallying cry for community partners who collaborate with us to prevent illness and injury to children. The Center for Children's Health leads the Community Health Needs Assessment research and outreach services for Cook Children's. The center works to prevent injuries and illness and improves access to services for asthma, child abuse and neglect prevention, healthy lifestyles, injury prevention, mental health, oral health, and parenting support. A key element within our Community Health Needs Assessment is the Community-Wide Children's Health Assessment and Planning Survey. This is a household survey of parents and caregivers of children newborn to 17 to assess their perspective about children's health across our communities. The survey asks questions about how various health issues affect their children and how easy or difficult it is to obtain medical care. We want to know the parents' perspective on children's health. This survey, available in English and Spanish, is administered to parents and caregivers through mail, phone, and email. Because we care about the perspective of all parents within our region, we send the survey to a random sample of 25,000 households within our 8-county service area. We also intentionally survey families experiencing homelessness and families with at least one undocumented member. We're able to survey enough parents to have a high level of confidence in our survey results. Parents and caregivers in each county also participate in virtual focus groups to give us a deeper layer of data. These focus groups allow us to further learn about the unique challenges parents face with accessing medical care and social services within our communities. In addition to the parent and caregiver perspective, we survey and interview leaders throughout the community regarding their views on children's health. Additional children's health data from national, state, and local public health and academic sources supplement the findings from parent and community leader surveys. We bring all this data together to share with communities across our region. Together with community partners, we work through our various collaborations to determine the best avenues to address these complex issues. It takes all of us working together to clear a path to better health for all children in our communities.
All right. Well, we collected quite a bit of information this time around, and we'd love to share additional details of our methodology efforts for those who would like to know more. For this reason, we have created 9 separate FAQ type documents that outline many additional details of how we conducted our research. You may also reach out at any time through the email address chna-feedback@cookchildrens.org if you would like to know more in the future. And we'll place a link in the chat for how to download those documents if you're interested. I also wanted to share that while we've conducted our parent survey, which is also known as CHAPS, since 2009, we knew that due to COVID-19 and other variables, it was time to update our survey to better align our questions with the National Survey of Children's Health. And this helps us compare our results to the national and state results. And Blair will provide some of that later in our CHNA data presentation. We not only better aligned our parent survey questions to the National Survey of Children's Health, but we expanded our survey from households of children 0 to 14 to 0 to 17 to help capture more information around the health needs of the teen population. Next slide, please. We also included 2 additional counties this time around, now surveying an 8-county region. And because of these enhancements, it means that we need to be mindful if or when we might compare data from different survey years. So we can still do comparisons on some of those questions, but because of the additional data that we've collected this time around, such as from our focus groups and our interviews, we aren't necessarily focusing on data from previous survey years today, but we do recognize that this work is complex and we know that progress is being made daily. Our parent caregiver survey methodology also included oversampling in counties with lower populations and weighting the results by zip code to ensure that geographic distribution of the survey sample was comparable to the actual distribution of the population, both at the 8-county level and for each individual county. And we completed our target of 218 surveys in Wise County. Next slide, please. So with our community leader survey, this survey is not necessarily representative of the population, but we did survey 306 leaders from across 8 counties, which is a really healthy sample size. Leaders selected one primary county in terms of answering the survey. And around 5% of respondents selected Wise as their primary county. We also asked what role they were involved in within their community. And they're allowed to select more than one role. The top 3 roles were the categories of health professional, social services nonprofit, and educator school official. And Blair will share more about some of these results in her presentation. Next slide. All right. Well, after Blair presents the results, Lauren will provide a final wrap-up of our data presentation. And before she begins, I would like to share a little bit more about Blair. Blair Williams is a child health evaluation analyst at Cook Children's Center for Children's Health. And for the past 15 years, her expertise and passion for public health has been focused on child and family health. In previous roles, she has served as a community health educator, advisor to healthcare and school administrators, developer of family-centered community wellness programs, and researcher for family wellness behaviors. Blair brings her experience, enthusiasm, and love for data to our community health needs assessments. She loves supporting Cook Children's and community stakeholders so we can all bring joy and improved health to every child. Take it away, Blair.
Thank you. Okay, so today's data presentation, we're going to use this acronym of HELP. And if you know me, you know that I love many things, acronyms being one of them and puns being the other. So I will hopefully not include a pun in today's presentation, but we will use this acronym of HELP to help us understand the role of social determinants of health in the needs that we're seeing in Wise County children. Next slide. So how do we help every child with their health needs? And that was something that video touched on quite a bit, and Becky in her explanation of her methodology, that really helps us to explore the needs in our community through that lens of social determinants of health, recognizing the role of parenting and family support in child health and their outcomes. So that's what today's presentation will focus on. Next slide. Okay, so just to recap all the information that Becky said, and that was included in our video, the CHNA data sources that are included in this presentation are the surveys of caregivers. And you'll hear me use the term parents and caregivers interchangeably throughout today's presentation. But just know when we say parent survey, we're not just talking about parents. We're talking about all types of caregivers. So that includes parents, step-parents, grandparents. It could be a foster child or adopted child. So we include a wide variety of caregivers in our parent survey. And another thing to point out, this is a question that we get quite frequently, is this just a survey of children who are Cook Children's patients? No, it's meant to be representative of the population of the 8-county service area and the counties that are included in our 8-county service area. So we collected over 200 surveys from caregivers across Wise County, and that's a strong enough sample size to have strong confidence in our results and be able to be a representative sample of the over 16,000 children living in Wise County. And when we weight it this way and we go about collecting a representative sample, we're able then to say that we can estimate the number of population of children that have a specific health need. So that allows us to give that estimate to you. And it also allows us to compare our results to the National Survey of Children's Health and see how we're performing compared to national and state benchmarks. This is especially important because of COVID. A lot of our health metrics, we've wondered if that had any influence because of COVID. So we'll go through that together in today's presentation. And also doing this allows us to report some of the health needs that you'll see today and some equity gaps that we'll also review together today. And as Becky mentioned, we did some qualitative research as a part of our CHNA this year. That includes interviews with over 25 community leaders in the 8-county service area. And in today's presentation, I'll include quotes from those interviews, but they're not identifiable and they're from leaders from across the 8-county service area. So these are not just Wise County leader quotes that are included in today's presentation. We are so thankful not only to the parents that participated in our focus groups, but also our community leaders who participated in those one-on-one interviews. So, so thankful to them that we want to respect their privacy, and that's why we don't see county level data or names associated with quotes that are presented in our findings. And we also include secondary data in our presentation and in our CHNA report. So the secondary data that you'll see in today's presentation include that from U.S. Census, a National Survey of Children's Health, and different CDC resources. Next slide. Good. So like our previous community health needs assessments, in our 2021 CHNA, we identified the following health needs across our 8-county service area, and that includes oral health, mental health, healthy lifestyles, parenting and family support, injury prevention, asthma, and overall health and equitable access to care. And at first, these might seem like isolated health topics, but the more we explore them and the more we have an understanding of these health topics, we realize that they're actually all interconnected, that they're all dependent on each other. And at the root of that is social determinants of health. If you can go to the next slide, we'll go over what that is. Thank you. So social determinants of health is a term that's used in public health. And if you're not familiar with this term, it's basically saying where you live determines your health. And so it could be where you're born, live, learn, work, play, worship, or age that has an influence on your health and your health outcomes. And for children, it's where they live, learn, and play that also impacts their health. So we'll have that lens throughout today's data presentation. Next slide. And that brings me to our health acronym. So I love acronyms. I use them every time I can. This really helps organize a lot of data in a really concise way. So for today's presentation, we'll use the acronym HELP as a framework to present the health needs of Wise County children, explore equity gaps, and any info on parenting and family support, since that's a focus for Wise County. And this framework also helps us see the intersectionality of the health needs and the role that social determinants of health play in each of these categories. So our acronym HELP is health, and that's equitable access to care and basic needs. E for environment, that's safety where children live, learn, and play. Learning is readiness and support for academic success. And P for parenting, that's parenting and family support. So this helps organize all of those key concepts that we're going to go over today. The presentation, of course, is going to be a high-level overview of our findings for Wise County children, and it includes simple stats and stories that are meant to support your work in the community. And some of this information might be known to you. You live it, breathe it every day, whereas other findings may be new and something that you could use to validate and support your work, or you could use the data that are included in this, our CHNA report, or a data dashboard for any grant works you're doing, or any types of documentation that you need to show that demonstrated need in Wise County. Next slide. All right, so we'll begin first with health. That's the first part of our health acronym. And again, health is equitable access to care and basic needs. And in this section, we're going to explore health status, oral health, and mental health status of children in Wise County. We'll explore preventative care, and if they received all of their needed medical, dental, and mental health care, and also access to basic needs. Next slide. So to begin, in Wise County children, most children have excellent or very good health, mental health, or oral health. And this is based on what we heard from parents, caregivers on that survey. To explain this metric a little bit more and how we get to this, we have 3 different questions on our caregiver survey. And we ask the caregiver on a scale of 5 points to rate their child's health, mental health, or oral health status. And those 5 points are excellent, very good, good, fair, and poor. And so here, the green icons indicate the children that have excellent or very good health status, mental health status, or oral health. You'll also notice on the right that the age groups change. So for health status, we're looking at children of all ages, 0 to 17. For mental health, we're looking at school-age children, that's ages 6 to 17. And for oral health status, we're looking at children ages 1 to 17, because at that point they have teeth, so we can understand their oral health needs. So for the most part, Wise County children are healthy, and we'll explore these each in the next couple of slides. So if you can go to the next one, please. Perfect. So here we're looking at the health status of Wise County children. And we can see that 8 in 10 children in Wise County, that's of all ages 0 to 17, have excellent or very good health according to their caregivers. Now, this rate is slightly lower than the local rate of 85%, and it is lower than what we saw at the national and state level before and during the pandemic. There are many factors that could be contributing to this, but if we look at that stat, and the number of children that don't have ideal health status, meaning their parents have rated good, fair, or poor for their child's health, that's about 2,400 children in Wise County that do not have the ideal health status. And if we explore this by age group, let's look at children ages 0 to 5, 6 to 11, and 12 to 17. We see that the children who are 12 to 17-year-olds actually have a lower percentage of parents who rate their health as ideal. So, and that 0 to 5 age group is 84%, just above that, and 91% for that 6 to 11 age group. Next slide. Our next slide is the mental health status in Wise County. And here we're looking at children ages 6 to 17. Again, this is based on what caregivers told us of their children, that 7 in 10 children in Wise County have excellent or very good mental health status. And this rate is consistent with what we're seeing at the 8-county level. That rate is 73%. And this is a new metric that we've included on our caregiver survey. So we will monitor this over time and explore trends in this data. And if we translate that out to how many children in Wise County that don't have that ideal health or mental health status, that's 2,600 children in Wise County. And if we compare age groups here, the 6 to 11 versus the 12 to 17, we see that that 12 to 17 age group is significantly lower than the 6 to 11 the age group. So again, we're seeing that trend in that 12 to 17 age group with health needs and mental health needs. Next slide. Now we'll look at oral health status of Wise County children, and 7 in 10 children in Wise County, this is ages 1 to 17, have excellent or very good oral health according to their caregiver. Now this rate is slightly lower than what we see at the local rate, but it is somewhat consistent with what we're seeing at the national and state level during the pandemic. We'll explore this oral health piece and the role of the COVID pandemic in just a moment. But if we translate this out, we could see that that's over 4,000 children that don't have the ideal oral health status in Wise County. And we could see that the age group that has the lowest rating for their oral health is the age 12 to 17 age group again. Next slide. This slide, we're looking at the percentage of children who receive all needed health care in Wise County. And we asked the parents and caregivers on the survey, did your child receive, what types of care did this child need but not receive? And from this, we could see that 3 in 4 children in Wise County received all needed health care in the past year. This includes their medical care, their dental care, and their mental health care. Now, this rate is consistent with what we're seeing locally here in the surrounding 8 counties, but just like it is with our local 8-county rate, we're seeing that the rate of children who received all of their needed care is much lower than what we're seeing at the US and state level before and during the pandemic. So local in Wise County, around 75% of children getting all the care they need, whereas at the national and state level, we're in the 90s of children, 90% or more, getting all of their health care that they needed. Now, there's a couple of reasons why this could be happening, but we could see that 4,000 children did not receive all needed health care in Wise County, and that may play a role in why their parents rated their health status the way they did or their oral health status. So that could be a contributing factor if they didn't get all the care they needed. And in a follow-up question, we asked the caregivers to explain why didn't their child get all their needed health care. And the top reasons that we found for Wise County were the COVID-19 pandemic. You know, a lot of clinics were closed during a period of time, or if there was just safety concerns, you didn't want to be exposed if unnecessary. Or clinics had shorter hours that they were open or limited staff, so they weren't able to see as many patients as they normally would. We also saw that insurance was not sufficient to cover costs. So while most children in Wise County are insured, the insurance may not have been sufficient enough to cover the cost of care. And another top reason why the children didn't receive all needed health care was that services weren't available in that child's area. And we'll explore that a little bit more too. But if we look at the types of foregone care by the type of care, we saw that the most common type of foregone care in Wise County and across our 8-county service area as well was that the children, 12% of children did not receive all needed dental care, 10% did not receive all needed medical care, and 5% did not receive all needed mental care. So those 3 factors there could also play a large role in what parents would rate their child's health, oral health, or mental health status, and the importance of access to care in that overall health status. Next slide. So here we'll look at insurance, and we could see that 9 in 10 children in Wise County have continuous health insurance coverage. This was a question that we asked on our caregiver survey, and it is in alignment with the national survey, so we could see how our local children compare at the national and state level. And we asked the caregiver, at any time in the past 12 months, was this child ever covered by any kind of insurance? And so they could say, yes, I was covered all 12 months for my child, or yes, but we had a gap somewhere in there, and no, my child's not currently insured. So this 9 in 10 children stat refers to the children that had coverage all 12 months of the past year. Now, this rate is consistent with what we're seeing at the local rate and with Texas benchmarks from before and during the pandemic. Now, if we explore those children that didn't have insurance, we could figure out by asking the caregivers what were some of the reasons that contributed to that. So we know that there's about 2,300 children in Wise County that did not have continuous health insurance coverage in the past year. And the parents cited reasons such as change in employer and employment status. And that was the highest. You could see there was 51% of those that were uninsured that rated that as the reason for not having continuous insurance. We also saw dropped coverage because it was unaffordable, or there were problems with the application or renewal process. Now that may refer to Medicaid, it may refer to other sources of insurance, but if they're having a difficulty getting onto that next level of coverage, then of course they would be having gaps in their insurance. Next slide. Now we'll take a break from our quantitative data and look at our qualitative data. That's the storytelling piece. So Here we'll have quotes from parents, community leaders. And what we heard were common themes of parents had to drive more than 40 miles to take their children to get the care that they needed. And 40 miles meant that they would either have to have really good transportation, or they'd have to have the flexibility to miss work or miss school in order to be able to take their children to their provider. And that also meant that they would have to find a doctor that accepted their insurance. So this was another theme that we were hearing from parents in focus groups. Another theme that we heard were that if a child was undocumented or the family was undocumented, that family would have hesitation in getting services that they needed because they were concerned that it might result in them being reported or deported. And even in some cases, parents concerned to get care because they were afraid that it might be reported to CPS. So these are barriers that we heard to access to care from our qualitative research. Next slide. And from our community leaders, of course, as Becky mentioned in our methodology section, we surveyed over 300 leaders from various disciplines across our 8-county service area. And these aren't just Cook Children's leaders, they're leaders just like you, and different ecosystems across our 8-county service area. When we asked them to rate how they felt about poverty or affordable housing in their community for children, over 60% of those community leaders felt that poverty and affordable housing were serious problems for children in their community. And of course, if a child is living in poverty or doesn't have stable homes or housing, then that certainly impacts not only their health and their access to health, but then it impacts their safety, which we'll cover in a moment too. And some common themes that we heard throughout different interviews was that there is a very clear distinction between children that have and have not, and that certainly plays a role in children getting all the care that they need. And we also heard that housing is something that is playing a large role in children not being able to have stable homes. So if they can't get adequate and decent housing that's affordable, then there are children that might be living in cars or motels. And then that poses access to healthcare issues as well as some potential safety concerns. And so if they're not in a stable home, that adds stress to the family. And then of course that has a large role in that parenting and family support piece too. Next slide. So if we look at our data by income, on our caregiver survey, we asked caregivers to tell us ranges of their household income. And before I get into that, if we look at U.S. Census data, we see that the median family income of households with children in Wise County is $73,000. And this was based on U.S. Census data in 2019. So we're looking at 73. Now, for that reason, to simplify our income and our data by income for Wise County, we're going to look at children in households with income below $75,000, and then look at children in households above $75,000. Now, there's over 7,200 children in Wise County that live in households below that 75K mark. And when we compare those children to households with income that's higher, we see that they're less likely to have the ideal health, mental health, or oral health status that we just covered on previous slides. They're less likely to have continuous health insurance coverage. That means a gap in their care in the past 12 months. They're less likely to receive all needed health care, and that includes their medical, dental, and mental health care. And they're less likely to always have access to nutritious foods. So certainly look at that percentage there. We're looking at 47% to 80%. That is a big difference there. And just that 75 annual household income can make a big difference there in child's overall health. Next slide. And if we turn back to that qualitative data piece, we see that child health and well-being is impacted by limited access to basic needs such as food, housing, and healthcare. And these were common themes that we saw throughout both our parent focus group findings and our community leader interview findings. And that challenge is that equitable access to health and healthy food, and that there are populations that were struggling before or had challenges before COVID-19, and then COVID-19, of course, just exacerbated that. Also, the role that dentistry has for children, that was, of course, the most common type of foregone type of healthcare that children do not receive in Wise County. We had a community leader interview that said, well, dentistry for kids is critically important. A good smile and good dental health is good mental health. So making that connection between dental care and overall mental health and well-being for a child. It might also, if they had dental problems, they could be missing school for dental pain or have difficulty eating. So dentistry, of course, is important. We also saw that the connection between, if a parent or family could not afford basic needs, it would make it very difficult for them to be able to take them to the park or enroll them in sporting or after school activities, either due to cost or just availability of scheduling. So then that played a role in their physical activity, and that played a role in perhaps their nutrition. And then that just creates a large snowball effect. Next slide. So to conclude the health section, of course, we'll move on to the other parts of the acronym. But in our health section, of course, we're talking about equitable care and basic needs. We're seeing that there are common needs, not only in Wise County, but across our 8-county service area, which is that equitable access to preventive care and treatment, access to basic needs such as safe and stable housing and food. And while I've highlighted a lot of the needs, I like to end each section with a positive piece because we heard a lot of great things from community health leaders and also parents during focus groups. And that is earlier in the pandemic, of course, impacted basic needs and food, and our community really stepped up to the plate. We had churches and programs that were helping young kids with food and adults who may have lost their job, and they're proud of their community. The community really came together. So we heard a lot of recognition of needs and organizations rushing to meet those needs and collaborating. So while I've highlighted a lot of needs, there's a lot of resources in the community as well that are addressing these. Next slide. All right, so the next part of our health acronym is E for environment, and that is safety, where children live, learn, and play. And in this section, we'll look at 3 metrics. That's ER visit due to an accidental injury, adverse childhood experiences or ACEs, and neighborhood and school safety. Next slide. First, we'll look at this accidental injury metric. On our caregiver survey, we asked caregivers to tell us if a child had received emergency care for accidental injury. And they could say yes or no. And in Wise County, nearly 1 in 8 children received emergency care for an accidental injury. That's an estimated 1,800 children. Now, there are 2 things about this question just to bring note and attention to, is that a child could have been injured but did not receive care. And so that would impact this number. We don't have that information with this particular metric. But if we look at CDC, and we even look at local data, we see that leading causes of unintentional injury deaths are for infants, suffocation due to unsafe sleep environments. For children ages 1 to 4, that's drowning. For children 5 to 17, motor vehicle traffic accidents. And for young children, that's that pre-reader age and teenagers, more unintentional injury deaths associated with poisoning or firearm injuries. And what's interesting, when we turn to the qualitative data piece of this, parents felt injury was just going to happen. It was part of life, and if you just look away for one moment, it was going to happen. Whereas leaders were saying, we need car seats out there, we need life jackets out there, we need all these resources out there to prevent injury. And that may include distributing car seats to families that need them, life jackets or water safety lessons around bodies of water, such as pools or lakes, or recognizing that if children are having to be home alone while their caregivers are working, that there may be older siblings that have to supervise them. So perhaps babysitting classes or making sure medication's locked up or guns are locked up. But again, if you really think through all this, it all connects back to that family support piece and that role of preventing accidental injury. Next slide. So for our next safety metric, we look at adverse childhood experiences, and that's also known as ACEs. And if you're not familiar with ACEs, it's a term that's used for adverse childhood experiences that are potentially traumatic, and they could happen in a child's life, either early or during their older ages. And those types of events could be divorce, a caregiver's death, witnessing violence, drug use, or a caregiver or someone in the family has severe mental illness that's not properly treated or diagnosed. So on our caregiver survey, we have 8 different metrics where we're measuring ACEs. And this is in alignment with what the National Survey of Children's Health does. So we're able to compare our local ACEs to the national and state data. And according to caregivers of children ages 0 to 17 and WISE, 1 in 8 children has 2 or more of these ACEs. And that's an estimated 2,200 children. And we could look at those ACEs individually. So the most common and leading ACEs in Wise County are a parent or guardian divorced or separated. That's 22% of children have experienced that. The next 2, which are bolded, lived with anyone who is mentally ill, suicidal, or depressed, or had a problem with drugs and alcohol. Those were the 2 that on a community leader survey were the highest concern for community leaders across our 8-county service area. So those are not unique to Wise County, but there is 11% of children who are living with someone who's mentally ill, suicidal, or depressed, and 9% of children that are living with someone who has a problem with drugs or alcohol. That's followed by parent or guardian serving time in jail or witnessing violence in the home. The others that aren't listed here are less than 3%. Now, how does this compare with what we're seeing at the 8-county level and the national and state level? This is fairly consistent with what we're seeing. So at the 8-county level, it's 14%, and prior to the pandemic and even during, it's that 14 to 16% range. So it is consistent with what we're seeing at the 8-county and national and state level. Now, one of the things, actually a common theme that we kept hearing in our community leader interviews was that the pandemic itself should be considered an ACE because it's been so disruptive and it's caused many changes in families, and it's been a stressor for many families. Now, the other thing is the children that have ACEs, it all ties in with all the other concerns that we see or health needs that we see, and that may be youth risk behavior, substance abuse, mental health, all that ties in. And some children may be appearing to act out or be more volatile or anxious, and that may be an indicator that something's going on at home that's potentially causing them to act out that way. Next slide. So if we look at child safety in Wise County by income, so again, that we're looking at that 75,000 or below versus 75 and up, we see that children living in households below 75,000 are more likely to have 2 or more ACEs, less likely to feel safe in their neighborhood or feel safe at school, and they're less likely to safely store firearms in a locked area in the home. And again, that's something that we heard quite a bit from community leaders during interviews, is that if there's an unsafe environment, that certainly increases their risk of injury or witnessing potentially traumatic events. And another piece is that if families are having to share, multiple families are having to share small duplexes, that could then pose potential sanitation, mental health, and safety concerns for children. Next slide. So to conclude the environment section, how do we help every child have safety from harm? We could see that there are needs around equitable access to emergency care and injury prevention resources, access to safe, stable housing and food, and parenting and family support. And another positive quote that we heard from community leaders was there was a lot of organizations that saw the need to help children and support families during the pandemic. This quote speaks to that really well. It says, the community is engaged and did a great job trying to combat food insecurity and provide rental assistance. And that the Child Advocacy Center saw an increase in their case volume, which was to be expected, but they are highly functioning and did a great job responding. So there are clearly a lot of great organizations responding to these health needs. Next slide. For our next section of our health acronym, we will focus on learning, and that is readiness and support for academic success. You'll notice that there are age groupings for certain metrics here, so I'll explain that with each slide. But for school readiness, developmental delay, learning disabilities, mental health, and also coping skills, resiliency, and self-regulation, those are all metrics that we'll cover here in this section. Next slide. So this first metric is school readiness. This is for children ages 3 to 5 only. We asked caregivers if they could rate their confidence on their child's readiness to learn based on their child's growth and skills. And they were given 4 different options, which was completely confident, mostly confident, somewhat confident, or not at all confident. In Wise County, 7 in 10 children are developmentally ready for school based on what the caregiver's perception of growth and skills is. Now, that's about 800 children that may not have school readiness. And it's important to point out this is based on caregiver's perception, but it does give us a good estimate for what we might be seeing in Wise County. And this rate is similar to what we see at the 8-county level. But it is lower than what we see at the national and state level from before the pandemic. And of course, it goes without saying that the pandemic has somewhat influenced this. It's something we heard quite from parents at focus groups and even community leaders. A common theme was that if children weren't in their normal learning environment, they didn't have that opportunity to be social or have that structure, and that may make it difficult for them to develop as they normally would, or for parents or caregivers to recognize potential delays that could be needing addressed. So COVID certainly has played a role in that. Next slide. Okay, so now we're looking at developmental and learning concerns. Now this metric is different than what we saw on the previous slide, because we are looking at ages 3 to 17, and we're looking at has this caregiver ever been told by a healthcare professional or educator that this child has this condition. So in Wise County, 9 in 10 children ages 3 to 17 do not have a developmental delay, and 8 in 10 children do not have a learning disability. Now, they may have it, but they just had not been told. So if we translate that out to the population of how many children in Wise County this represents, it's over 1,000 that have been told they have a developmental delay, and it's over 2,000 that have been told they have a learning disability. So another common theme, along with the one that we just talked about from our community leaders and parent focus groups, was that having that availability of awareness of what is normal and what might be a concern, and screening certainly plays a large role in helping that child prepare for academic success and support for that family, which we'll explore more in the next section. Next slide. Now we'll look at mental health conditions. This is for children ages 6 to 17 only. And this has ever been told by a healthcare provider and have had a diagnosis. So in Wise County, 6 in 10 children do not have one of the most commonly diagnosed mental health conditions. And for the purpose of this question, we're looking at the most commonly diagnosed mental health conditions in children ages 6 to 17, and that's anxiety, ADHD, behavioral conduct problems, or depression. Now, let's look at how this looks for trends. This Wise County rate, so that means 43% of children, 43% of Wise County children ages 6 to 17 have at least one of these most commonly diagnosed mental health conditions. That is higher than what we're seeing at the local rate, which is 31%, and at the national and state level, which are about 23%. So Wise County rate is much higher than what we're seeing locally and national and state. Now, how does this translate out to population-wise? That's over 4,000 children that are school-aged that have at least one of those common mental health conditions. And if we explore this by income, age group, and ACEs, we see that children who are in income below 75,000 are more likely to have at least one of these conditions. We also see it higher in that age group of 12 to 17, and of those children that have 2 to 8 ACEs. And you can see that comparison there for children that have 2 to 8 ACEs is 60%, whereas children with 0 ACEs is 36%. So this connects to not only family and parenting support, but it connects to some of the other concerns that we have with the pandemic, and that the pandemic itself could have been an exacerbated mental health conditions or anxiety. But locally, of course, we've seen that increase, and even at the state level, national level, an increase in youth suicide. And so many community leaders have recognized that and have been focusing on suicide prevention, helping with basic needs such as access to food, and improving resiliency to help provide protective factors to children in need. Next slide. So on this slide, we're looking at those 4 most common conditions that I just mentioned. We're looking at ADHD, anxiety, behavioral conduct problems, and depression. And this is all for school-age children ages 6 to 17. That gold bar is Wise County children during the pandemic, and the blue bars represent the state and national benchmarks before the pandemic. So we could see that over 30% of school-age children have had a diagnosis of ADHD according to their caregivers, followed by anxiety and behavioral conduct problems and depression. But you could see that Wise County rates are much higher than what they were before the pandemic at the national and state level. The data for during the pandemic around this is being released. It just came out in October. So when we have that data available, I'll be able to share with you what those during pandemic results look like. Next slide, please. And here, let's talk about resiliency and coping. So we talked about all the negative, right? All the needs, but here I like to talk about resiliency and the positive pieces. What are those protective factors? So on our caregiver survey, we ask 3 questions. We ask and it's in alignment with the national survey, which have been questions designed to get at resiliency and coping skills and child's ability to self-regulate if they need it. So those questions are 3 questions. Show interest and curiosity in learning new things. If the child works to finish tasks that he or she starts, and if they stay calm and control when faces the challenge. So those are the 3 metrics that we're looking at in terms of coping and self-regulation. And we could see that most children in Wise County, if you look at that 3rd bottom bar, 63% of children in Wise County have those coping skills that I just mentioned. That's 3 coping skills. The light blue is 2 coping skills, and that gray is 0 to 1 coping skills. Now, this is United States data here provided for a benchmark, and we could see that even during the pandemic, Wise County children had a slightly higher rate of those that had coping skills and self-regulation compared to the US estimate. Again, this plays a factor in helping children with mental health needs and also coping with challenges. Next slide. And now that we know that the rates of mental health and anxiety, ADHD, depression, behavioral conduct problems, and even ACEs, how do we pull that all together, and how does that support families and children recognizing these needs? So common themes that we heard, not only from our data, but the qualitative focus groups of parents and community leaders, is that access to developmental screenings and behavioral health may be limited for some families. That could be in part due to the pandemic, or they have an undiagnosed mental health condition, ACEs, other social determinants of health, or that caregiver's concern of being reported or deported. And when we look at the needs and gaps for children ages 3 to 17, we saw that 1 in 5 did not have continuous health insurance coverage. So that may play a role in them not being able to get the care they need. 1 in 3 school-age children may have a negative impact to their mental health due to the pandemic. 3 in 4 children have a caregiver who's not very familiar with mental health services in the community. And as I'm going through this, these are all Wise County data points. Nearly 800 children do not receive all needed mental health care in Wise County, and that's primarily due to that pandemic, inadequate insurance, or limited availability of services. And nearly 3,000 children needed mental health treatment or counseling, and that over that 3,000 children, over 70% experienced difficulty getting the care that they needed. So that plays a large role in overall child health and well-being, and also supporting parents. Next slide. And if we explore this through the lens of a healthy lifestyle behavior, so we're trying to promote eating fruits and vegetables, reducing screen time for entertainment screen time, getting that physical activity, sleeping, all those, eat your fruits and vegetables and exercise spiel, right? We look at the children that have been diagnosed with one of those 4 most commonly diagnosed mental health conditions versus those that have not. And we see that in all categories, they're less likely to meet all those wellness recommendations. So for children that have a mental health diagnosis, they're less likely to eat that fruit and vegetables most days of the week, 2 hours or less of entertainment screen time, 1 hour of physical activity every day, 8 hours of sleep every day, and have a family meal on most days, which there's lots of research that supports the importance of a family meal as a protective factor and the opportunity for caregivers to talk with their children about their school day or any concerns that they have going on at home. And from community leader interviews, a common theme that kind of pulls all this together is that mental health has been impacted by just the fact that junior high and middle school and high school, all that is super challenging now. But then you add in social media, bullying, cyberbullying. And if there's not opportunities in the community for children to be outdoors and playing or participating in after-school sports, then that certainly could play a large role in not only their overall health and their BMI, but also protective factors for their mental health. Next slide. So to conclude the learning section of our health acronym, we see that there are needs around equitable access to developmental screenings and mental health services, access to safe, stable housing and food, parenting and family support, and resources for coping, resiliency, and suicide prevention. Again, a positive quote that we heard from community leaders is that we made sure we have a social worker on each campus this year due to the increase of these types of needs. And the kids cannot focus on learning if their basic needs are not met. We want to be sure that they are all provided with existing community resources. This is a perfect example of something that we heard multiple sources. There are educators and supporters in the community that have recognized this and have come forward to offer help in the ways that they can. Next slide. So for our last section, last but certainly not least, is our parenting piece, and that's parenting and family support. Here we're looking at caregiver coping with parenting demands, and if that caregiver has a source of emotional support. And again, just as a reminder, when we use the term parenting here, we're talking about all different types of caregivers, not just biological parents. Next slide. So first we'll take a look at parent coping. This is a survey question that we've included not only in previous CHAP surveys, but also in alignment with the National Survey of Children's Health. And this is one that we closely monitor with every CHNA report. We have a question where we ask the parent how well they're coping with daily demands of parenting. They have 4 options. They could choose very well, somewhat well, not very well, and not very well at all. So for children ages 0 to 17 and WISE, 64% of children have a caregiver who is coping very well with day-to-day demands of raising children. On that 4-point Likert scale, that's that very top, very well option only. Now, how does this compare to local and US rates? We see that this is higher than what we're seeing at the local and national levels. And it is somewhat consistent with what we're seeing with that Texas benchmark from before and during the pandemic. Now, if we translate this out to population of children, just under 6,000 children that have a caregiver who is not coping very well, meaning they could have been somewhat well, not very well, or not well at all. And if we look at this metric by income, mental health, and ACEs, we see that the rate of not coping very well, meaning those 3 other options, was highest in those incomes below 75,000, was highest among the children with mental health conditions, and was highest among the children with 2 to 8 ACEs. And then from parents and community leaders, this was a theme that was loud and clear, was that COVID and just in general, financial stress, emotional stress, it's a lot of stressors on families, and this could be influencing this rate of caregiver coping very well. Next slide. The next metric that we look at is emotional support for parenting. We ask the caregiver if they have a source of emotional support, and they could either say yes or no. If they say yes, we ask what is the source, and they could select multiple options for that. We see that 91% of children in Wise County have a caregiver who has a source of emotional support with parenting or raising their children. And in Wise County, the most common sources were other family member or close friend, a spouse or domestic partner, a place of worship or religious leader, a healthcare provider, or a peer support group. And this is somewhat similar to the local rate, but it is much higher than what we're seeing at the national and state level, which were in the 70s. So quite a bit of caregivers have emotional support in Wise County. And if we translate this out to the population of children who don't have a caregiver, well, who has a caregiver who doesn't have emotional support, that's 1,500 children. And for parents and focus groups, particularly single caregivers, they didn't have a source of emotional support, but they would attend church group meetings. And that was a great source of support, being able to vent and getting support from peers. And that single parents were also just tired and exhausted, and it was hard for them to come home and give all their attention to children. So this definitely plays a large role in all the other factors that we've mentioned. Next slide. Okay, so we'll look at awareness of community resources. In Wise County, we ask caregivers 4 different questions where we ask them to rate their familiarity with dental services, healthcare services, mental health services, or a 211 hotline. And from this graph, you could see that over 60% of caregivers, children with caregivers have a very familiar awareness of dental and healthcare services in Wise County, whereas mental health and 211 are just below 30%. So getting them the care that they need. Now, these resources may be available in the community, they just may not have an awareness of it. But that certainly helps get them to not only equitable access to care, but additional support for emotional support or basic needs. Next slide. So to conclude the parenting section of our HELP acronym, we see that there are needs associated with awareness of parenting and family support services, equitable access to healthy food, physical activity, equitable access to family-centered care, such as like preventive care, health education, and assistance with basic and social needs. And to end on a positive quote, organizations were certainly pulling together. And this was a common theme that we heard throughout, that if a family had a unique need, they recognized they found out how to get that resource to that family, and then by doing so, they now had an awareness of that resource and could share it with many more families. So it was a positive thing to see that piece happen and the collaboration around those health needs. Next slide. Thank you. So to conclude our HELP acronym, how do we help every child with their health needs? All of the data here has been organized in this acronym, not only because I love them, but because it helps organize everything in a clear, concise way. Health, environment, learning, and parenting. We've covered equitable access to care, safety, readiness and support for academic success. And of course, that huge piece of parenting and family support. Now, I did present a lot of data, very quick, it's high overview. We have so much more. And if you have any questions or you're a data nerd like we are, I encourage you to look at all those FAQ documents that you received in your packet. Review our CHNA report when we make it public, and we'll let you know when it's ready. And also visit our data dashboard, because you could go onto our website and explore Wise County data with all the metrics that we included on our caregiver survey. You could also see the results of our community leader survey, and that may be helpful to you in your work in the community. So with that, I will turn it over to Lauren, and Lauren will take it away.
Thank you, Blair. Every time you do this is better than the last. So thank you so much. I hope that Blair's been able to give you guys some really good insights to think about. We've been really excited to share all of this with you. And I saw some of y'all taking notes and kind of nodding your head as we went along. And so it sounds like that's the case. But before we break, I'd like to just recap a few of those key points from Blair's presentation. And so for Wise County children, their health needs, we need to focus on preventive care for health education and those community resources and social support to support child health and well-being. For children's environmental needs, they need safe and stable and nurturing environments to reduce the risk of physical or emotional harm. For children's learning needs in Wise County, they need preventive care, developmental screenings, behavioral health, or social services to support that academic success. And then for those Wise County parents, we need to help address the social determinants of health, such as access to basic needs and healthcare or safety, with social and emotional support for families. And so later in this session, we'll have that interactive dialogue where we can really discuss some of this data and how to help children and families in Wise County. So while we kind of transition here to our break slide, I'd like to just kind of go over the questions really quick, so that way you guys can go ahead and start thinking about them while we head into this break. And then you can even like maybe put some of your thoughts in the chat, and we can have some dialogue there, and then bring some of that into our discussion here during the second part of our summit. And so the three questions that we want to ask you all to consider, to think about, are based on the data presentation that you just heard. What resources are available for families in Wise County related to parenting support? Based on the children or families your organization serves, what types of community resources do families need the most? And are there collaboration opportunities for providing or sharing these resources? And then the last one is, what other organizations need to be at the table to improve children's health in Wise County? So I don't expect you all to remember that. We'll have a slide up with those questions, but like I said, feel free to share your thoughts in the chat, and we'll go ahead and take a 15-minute break, and we'll come back just after 10:30.
And before I introduce our next speaker, we wanted to share another video. Earlier, we saw a video about why we conduct a community health needs assessment and the different methodologies we used. We would now like to present a second video on what we do with this data, how important it is our community coalitions and partnerships are to the entire process.
How do you improve the health of 1.2 million children spread across 8 counties? Well, it takes a lot of planning, a lot of collaboration, and it takes a lot of support from people like you. Every 3 years, the Center for Children's Health pulls together important data from the public through the Cook Children's Community Health Needs Assessment. That information helps us to build strategies to meet our region's most pressing needs through our programs and through our coalitions and community partners. We then work diligently to track our success. Are we all moving the needle like we want? Are we making a difference? This work is bold and big. Change at the community level often takes decades to fully integrate, but progress is being made daily through all our dedicated partners working together. We report on our progress annually to the government, state and federal, as well as to Cook Children's leadership and other internal departments. We also celebrate this progress with our collaborative partners and build on the collective wisdom our shared experience provides. Although we've always used data to drive our work, our first formal community health needs assessment in 2009 and the assessments that have followed validate the work we do through our collaborations and programs. Data also guides us on how and where we do our outreach. It's data-driven decision-making so that everyone benefits. As we review the most recent assessment data to create strategies for the next 3 years, we take into consideration what has changed in the communities. Are there changes in available resources? Are there new methods to address the needs? We also rely on our partners who live and work in each community to provide helpful context on key people and organizations to work with, approaches that have been successful, and where there are gaps we might help bridge. A few examples of how we utilize our assessment data include: determine new ways to support equitable access to care for all children, expand parent support educational topics, develop a program to identify and remove asthma triggers in the home, strengthen oral health messaging for pregnant women, promote a healthy lifestyle curriculum, including gardening basics for children. We then recommend revised strategies to Cook Children's leadership. Once approved, we have a roadmap for the work we will lead or support in our communities over the next 3 years. Every year, we coordinate progress reports that outline the incredible work our programs and collaborations are doing to improve the health of the 1.2 million children in our region. Gathering this information from families, leaders, and partners is a fundamental element in our efforts to help each child reach their full potential. The overall process is definitely an investment, one that will serve our community well for decades to come. Thank you for the part you play in improving the lives of children and families. Visit our website to learn more.
I am excited to introduce Nicole. She joined the coalition in 2019 and jumped in with both feet, becoming involved. Nicole Rosenbaum is the Assistant Director of Partner Relations for the Child Advocacy Center for North Texas. She joined the Advocacy Center in January of 2020 to direct the center's expansion of services to Wise and Jack counties. Prior to joining the Advocacy Center, she was an investigator for the Department of Family and Protective Services for 6 years. For 5 of those years, she was in Specialized Investigation Unit housed in the Child Advocacy Center. She volunteered as a CASA for 1 year while in college. Nicole holds a bachelor's degree in psychology from the University of North Texas. Nicole enjoys spending downtime with her husband, Jonathan, and their 4-year-old son, Max. Nicole, I'll hand it over to you.
Thank you, Jamie. Good morning, everyone. Like Jamie said, my name's Nicole Rosenbaum. I'm the chair of the WISE Coalition for Healthy Children. And I'm going to take a moment to share some highlights of the work that the Coalition has done in recent years. In 2011, the WISE Coalition for Healthy Children formed in response to the first CHAPS survey results. And in a nutshell, the Coalition works to increase community awareness about child abuse prevention and to promote healthy family relationships. We also developed a vision to guide our work, which is all Wise County children have the opportunity to grow in a safe and loving environment, free from abuse and neglect. The main goals we employ to carry out that vision are engage Wise County community to improve children's health, increase community awareness about good parenting and healthy children to support families and children, promote healthy family relationships, monitor and support children's health issues and community initiatives to reinforce a safe, secure, and healthy community for children. One major focus of the Coalition is to support positive parenting practices that evidence shows reduce the risk of child abuse. We do this by bringing parent cafes to the parents of Wise County. Parent cafes are small, intimate settings where parents and caregivers have the opportunities to discuss their families, discuss challenges of being a parent, share ideas, and learn proven techniques adapted from an evidence-based program. They are a community-based initiative. We collaborate with individual volunteers and community partners to offer cafes. The Coalition has equipped over 30 community volunteers with the tools needed to facilitate parent cafes, using an evidence-based curriculum called the Community-Based Education and Nurturing Parenting Program. Last year, we were able to add 10 new parent cafe topics to our current offerings. The Coalition collaborates with multiple community partners for hosting parent cafes. These partners provide the facility and parking, childcare when applicable, and assistance with marketing cafe sessions. Most of our parent cafes are offered at schools with the school counselor leading the parent cafe. This year, parent cafes have been led at Bridgeport Intermediate and Decatur ISD. This past year, the Coalition also strengthened their partnership with Wise Health Systems and the Center for Emotional Wellness to offer parent cafes to parents of newborns. Since the inception of parent cafes, the Wise Coalition for Healthy Children has partnered with the community to host over 130 parent cafes, in person and virtual, provided parent education and support to nearly 500 Wise County parents and caregivers. More than a third of our parents attended more than one parent cafe session. And it's especially rewarding when they share how they utilized information learned from the previous lessons and knowing that they really took it to heart and are connecting with their children more as a result. Because of COVID-19, we pivoted our parent cafe programming to continue reaching our parents. We held several virtual parent cafe events to ensure parents continued to receive support and resources. Turning now to our efforts to engage the community and increase awareness about community resources for parenting, the Coalition adopts a number of strategies. After our last summit in 2019, the Coalition began hosting counselor roundtables twice a year. The roundtable allows for discussion and networking of Wise County school counselors to discuss specific needs of the community that they serve. They're hosted twice a year, typically January, February, and in July and August timeframe. Schools, parents, and the community can work together to promote the health, well-being, and learning of all students. When schools actively involve parents and engage community resources, they're able to respond more effectively to the health-related needs of students. For the first time this year, Wise Coalition for Healthy Children partnered with Boyd ISD to pilot an art contest to support mental health awareness in Wise County. Boyd ISD was selected due to a partnership already in place with Wise Health System and Coalition member Heather Beal's connection. We also defined Boyd ISD as a small district, which is something we were looking for with this pilot. So discussions began with Boyd ISD, Coalition and community members in fall of 2021 to plan and implement this contest. Boyd ISD did a great job. They just took on and owned the project. They helped promote the art contest, oversaw the project in their schools, matted the artwork, and cataloged the work as it came in. They also found judges in the community and additional prizes that were added to the prize bags. The Coalition provided guidance, forms, and art supplies and prizes to help with this contest. Wise Health System helped with creating the flyer, prizes, and transporting the artwork during the traveling art show. That was a phase of the project, which is still going on now. You can go and see the top 3 winners at each Boyd ISD school at these locations. May 2nd through May 9th, they will be at Cool Creek Art Gallery in Bridgeport. And May 9th through May 16th, they will be at Decatur Public Library. Wise Health System also helped facilitate a write-up in Wise County Messenger. There was an article written and published on April 22nd, highlighting the art contest, sharing the dates of the traveling art show, and addressed the need to talk about mental health at an early age. Since the coalition's inception, we've distributed over 21,000 parenting support tools and educational resources. This includes education on positive discipline strategies, parenting self-care, and other evidence-based information to promote parenting best practices. April is National Child Abuse Prevention Month, so our coalition makes a special effort to increase community awareness with the support of our members and partners. This year, the coalition partnered with CASA to highlight the importance of child abuse and neglect prevention on the courthouse lawn by providing pinwheels. Wise Coalition for Healthy Children also partnered with CASA and the Children's Advocacy Center for North Texas to host a family fun night in Decatur Town Square on April 18th. It had an amazing turnout. Judge Clark also joined us and read a proclamation acknowledging the importance of creating a community that keeps our kids safe and secure. Thank you to CASA for helping us set up that process. And finally, the coalition celebrated its 10-year anniversary last year. It's a huge milestone, and it speaks to the dedication and commitment the Wise County community has to improve children's health. These accomplishments would not be possible without the wisdom, resiliency, and support of the members, leadership, and partners of the Wise Coalition for Healthy Children. So everybody, please join me in thanking them for all they have accomplished. We're grateful for all of the work these individuals have done, and every so often we get the opportunity to recognize one of those members for their hard work and dedication to improving children's health. At this time, I'd like to turn it over to Courtney Bernard to do just that.
Hi, everyone. I'm Courtney. Thank you, Nicole, for that great description of all the work that the coalition has been doing in Wise County for years and years now. Every time we have a summit, we report a little bit more about what the coalition's been doing in recent times, and that list just seems to grow each summit that we have. And so, yes, to Nicole's point, we do like to pause every once in a while and reflect back on those outstanding community partners who just go above and beyond the call of collaboration. And we do this as a Center for Children's Health. And so today we'd like to recognize a partner with the Green Crystal Award. And this award is given to community champions who provide extraordinary support at the county level to advance the objectives of Healthy Children 2030 and who advance the work of the coalition such that it would not have happened without their leadership and extra dedication. And so in this case, we're referring to a partnership with Heather Beal at Wise Health System, as she has helped move forward the work of parent cafes in the art contest pilot. So I'd like to share some details around her contributions that led us to recognize her with this award. So Heather's been integral in connecting the coalition with other partners across the county. So she has been a big player with planning the school counselors roundtable, finding speakers, providing resources to the counselors, in this connecting those school counselors with Wise Health System and their ECHO group, their community health outreach group. She provides oversight of that ECHO group in Wise County, which led to the partnership of the coalition with Boyd ISD to pilot that art contest. And so here she's provided not only that partnership to get it lifted off the ground, but providing that instrumental support and facilitating that implementation of the My Feelings Are a Work of Art youth art contest pilot. And as you heard Nicole share, it was covered by the Wise Messenger, and those artworks are being displayed all over the county. The pieces are just absolutely precious from the kids. So that's been a huge success. And then again, Heather stepped in to really strengthen that partnership between the coalition and Wise Health System by helping to expand the Parent Cafe program to parents of newborns in the labor and delivery unit at Wise Health System. So not only are you guys helping to connect families with their own network of support at the school level, but also new parents or parents of multiple children within Wise County, giving them those resources and connecting them right at the start of parenthood. So that is huge. So Heather, we just can't thank you enough for strengthening those relationships across the county, expanding our programming to reach new targeted children and families. And with that, we just want to thank you in this one way with the Green Crystal Award. So, and I'm glad that you're here with us today. I'll first ask Jamie, our coordinator, to say a few words about why she nominated Heather. And then after Jamie, Nicole, I'll ask for you to say a few words as well, because you touched on that in your presentation.
Thank you, Courtney. So I nominated Heather, like we've heard, due to her support for the Mental Health Art Contest and supporting and leading the parent cafes with the Coalition and the Center for Emotional Wellness. Heather has shown up to every meeting that we have had for these two projects or hosted those meetings, and I appreciate that. Heather, thank you for your time and support. The Wise County community benefits greatly from your energy and efforts. Nicole?
Yes, thank you, Heather. I truly believe that the coalition is only successful because of individuals like you. You are all in every time. Like Jamie said, you're always there, always willing to help. You have a lot of expertise, a lot of skill, and one of those being bringing people together and knowing how they can connect. And so again, we say thank you and congratulations.
Heather, would you like to say anything, share any words with us today?
Sure. I'm not super chatty, but I just wanted to first of all say thank you. This is a really big honor for me, but also thank you to the Wise County community, the Wise Coalition for Healthy Children. Without y'all, this would not be possible. For almost 20 years now, which is crazy to think about it, Wise County has really had a focus on health, the health of our community. And without that, none of this would be doable. So I just want to say thank y'all to y'all also.
Thank you, Heather. Yes, we very much appreciate you and agree with your sentiment there. It takes all of us, but like Nicole said, it takes special people just like you to help keep it moving. So we appreciate you and your partnership. With that, we are going to move into a facilitated group discussion here. So you saw those questions. Lauren teased them for us, and you saw them playing throughout the break. But we really want to follow up on that data presentation with what you all see, how you all see that data in action in your community. So we had a couple of questions that the coalition chose for us to discuss today. And I'll invite Jamie and Lauren and Blair to join us. But you should see a poll pop up on your screen here with that very first question. And that is, what resources are currently available in Wise County related to parenting support? So we've been talking about this all morning. You heard the great work being done by the coalition and by partners like Heather. So I'll let this poll run. And while we do that, let me also add, if you are one of the folks choosing other, or if you just can't choose one option, feel free to also put your response in the chat. because we love to build on this as we go through our conversation today. So let's see here. I'll open it up while we wait for people to answer the poll. I'll open it up to Lauren and Jamie and Blair to get us started on the resources available for families in Wise County.
Yeah, I'll go ahead and start.
Oh,
Lauren, you want to go?
That's so funny. Sure. No, I was just going to say, Blair touched on a few key things that, again, we have a sneak peek here so we can kind of see some of those results, but we have those like protective factors to keep families strong, and parent cafes is obviously one of those, but Blair touched on a little bit about like the developmental screenings and how important those are, and we know that Help Me Grow does some of that for kiddos in Wise County. And then there was a quote too from, I think it was the Child Advocacy Center, talking about how they're so proud about how they've been able to respond to children's needs who are experiencing ACEs and provide that family support. And I know that there's many more out there that Blair and Jamie will probably touch on, but I think those are two really key resources that Wise County has available.
mm-hmm.
Thank
Jamie.
you, Lauren. Yeah, I was gonna, Faith had put this in the chat before I could even say it, but the MHMR Help Me Grow and the Family Resource Center in Springtown, which a part of that is in Wise County. I want to talk about the libraries that are available. Chico and Decatur Public Libraries have a lot of parenting support, and then Head Start with the little ones, and the churches, and we talked about that in the Blair had talked about that in her presentation. And then also the reading library through Wise Health System. Whenever the kids are born, they can sign up to be a part of the reading library. And Heather, I don't know if you want to touch base on that, but it's the Dolly Parton Reading Library, and they sign up for books. And then they get books sent to them on a monthly basis for the first 5 years.
Yeah, the Dolly Parton Imagination Library. So any child living in Wise County under the age of 5 is eligible. It's completely free to them. So if y'all know, I think we have close to about 1,000 children in the Imagination Library right now. So it's wonderful and a great program. And if y'all have any questions or know of families or anything like that, please let me know. I would be happy to register them.
That's incredible. And I also see Shelly, because you introduced yourself in the beginning, I remembered that you were on the call from Decatur Public Library. So this is just absolutely incredible. Do you mind sharing more about, if you don't mind unmuting, and share more about what it means for the library to become a family place library?
We are in the process of becoming a family place library, which offers opportunities for families. We offer programming for families and children to get parenting skills and find out about resources in the community and all those things. So, yeah.
That's fantastic. Thank you. We can't wait to hear more about that as you guys get that designation.
Yes.
I also want to point out that Patty, our dear friend Patty Seckman, also talked about schools as a resource, the school counselors where parents turn to for assistance. And we heard Nicole talk about how parent cafes are occurring in some local schools as one way for families to get connected. Patty, did you have anything else about that you wanted to share?
Well, I do think that there is a resource list, and I know in the past, WARM has kept that up. WARM is our mission there in Decatur. And with the counselors having their roundtables, that networking and that gathering of information and how to actually distribute that out to parents, I think is very beneficial. So I do think a lot of that falls on the counselors there at the schools, whether that be public schools or private schools. So, keeping those resources where they have them readily available to share with parents, I think is very, very important.
That's fantastic. Thank you, Patty. And I'll note, gosh, those two last resources of schools and libraries that we discussed were not one of our options on the poll. So I'm glad we were able to talk about that. Before we hop to the next question, Blair, I'll ask you to comment on maybe our poll responses here and how that might match up with our with those responses you saw in the CHNA.
Thank you, Courtney. One of the things I would say surprises me but does not surprise me is that Wise County had the highest percentage of parents that were coping very well compared to other counties. And it just really speaks to all of the resources and collaboration in the community to support families. So that was really encouraging to see, especially if we look at that trend across the state and nation, that trend has been decreasing since 2015. So the fact that Wise County has the strongest percentage of parents coping very well is a testament to all of the great work that I've just heard in a few moments, but have known for several years. So great job there. And then just that speaking on that mental health and ACEs, several of you have already touched on that piece, but just helping families, not only children get access to mental health and support services, but also their parents, because if their parents have those resources, then they're more equipped and supported to help their children, and that helps mitigate a potential adverse childhood experience for that child. So those were some of my key takeaways, but I have some additional, but again, like I said, that parent coping percentage being so high, it was just really remarkable.
Yes, Wise County. If I've learned anything in the last several years of working with folks in Wise County, it's that it's well-resourced and people are well-connected. And what I hear over and over from our partners there is they say if they see a need and something needs to be done, they make it happen and they come together. So with that, we'll go to our second question, and that is, we heard from the data what some of those common needs are from children from our data source, but all of you on the call with us today, what do you see as the greatest need of the families that you work with or serve? And so, Blair, I'll ask you to start us off by kind of connecting this question with the data. And I'll remind everybody too that you can also add in the chat if you have other information to share. So Blair?
Sure, thank you, Courtney. Of course, the center of all of these health topics is that social determinants of health, and recognizing that where a family lives, not so much their home type, but their zip code or their county can also play a role in that. And so for some children, they may not have access to certain services in Wise County, so they may have to travel 40 miles or more to get to where they need. That could potentially be a factor as to why so many children did not receive all of the care that they needed. And also that contributing factor of, if we look at the percentage of children who did not receive all of their health care, we see that COVID played a large role in that inadequate insurance coverage, or just that, again, that far distance to get to the services they needed. So having access and equitable access to healthcare and basic needs really helps reinforce overall child health and their health outcomes, and prepare them for academic success in the learning environment.
Mm-hmm. I love that. And yes, I just shared the poll results and I'm seeing all kinds of things come through in the chat. This is great. Nicole shared, lack of transportation options is a huge thing. And of course, in a community as dispersed as Wise County, I would imagine that's an ongoing issue. It's one of the benefits of a rural county, and one of the hardships of a rural county. And so then Heather also responded that she has a few transportation options that she can share. Let's see. And Lauren, I'm going to ask you to unmute and share what you wrote in your chat comment there.
Oh, yeah. I hate that I can't remember the article that I'm referring to, but I can do some digging if anyone's interested. But it was really focused on, again, the inequities of transportation. Anywhere in Tarrant County specifically, I'm not as familiar with Wise County, but the bus routes can take 1 to 2 hours just for some people to get places. And so, if you have a job or whatnot that's up in far north Fort Worth and you're leaving from downtown, that can be really difficult to access. And again, if you're fortunate to have a bus route, that's great, but not everyone has access to that, or getting to the bus route can be difficult or challenging. And so maybe your mode of transportation is a bicycle. Well, that's a whole other challenge whenever you're talking about how to get from point A to point B. And so, yeah, it's just, I think Nicole brought up a really great point about how getting access to certain resources can be difficult if you don't have the mode to get there.
Mm-hmm. I love that. And so on the poll results, then we also see that access to basic needs is a need we hear over and over and over again. We just know people aren't even getting the basics sometimes. And so Shelley added a nuance to that in the chat, and that is a lot of families don't even know where to start. They don't know where to get the help they need. And Patty, you mentioned the list of resources, and I know there are others that can be helpful, but if parents or families aren't aware that a list like that exists or don't know who to go to first to ask for such a thing, then what do they do? Let's see here. And then we also, of course, Kim Dunlap in the chat talks about mental health, needing additional mental health providers to provide timely services. Kim, do you have any other thoughts to share around that?
Well, I think we are getting, with our Center for Emotional Wellness, we are starting to have facilities available, but what's happening now is having those qualified counselors and providers so that you can receive services in a timely manner and you don't have to wait an extended time. So I think as we get those things established, and I think we're doing a good job in doing that, it's just showing the great demand we have. So I think that's going to be something that we always need to be aware of, that we need to continue to encourage folks to come and practice and provide those services in Wise County.
Mm-hmm. Thank you. And Anna Luisa put in the chat also, again, adding to this conversation here, not only do we need those counseling services, but bilingual counseling services, and thinking about who else needs to access services, and do we have those resources available, widely available. Anna Luisa also mentions needing more dental and medical providers that accept Medicaid. Anna Luisa, would you like to share anything about that, that aspect of care needed?
Well, our families working with Early Head Start, our families, I do see them struggle, as mentioned earlier, getting to and from the doctor or dentist appointments, as they are not local. So there are some available here, but it seems like a lot of them are going out of town to take their children to a medical provider or dental services. And a big one is transportation, not only for those appointments, but even to school, to bring them to the, oops, sorry, I'll turn that on. Okay. Sorry, to bring them here to the program on a daily basis. Either they're struggling because their car broke down, or they don't have a car, or even getting gas in their car to bring their children here. So that's a big one. transportation services. We don't have anything like that for this program to get our families back and forth, unfortunately. But what's out there to be able to help in these situations.
Thank you. Yeah, that's so important to remember, and kind of how all of that intersects and overlaps with all the other issues. So we don't want to overlook that piece. I think as we've got just a few more minutes of our discussion time left on the agenda, so I'm going to combine these last two questions because they're related. But that is, so we've heard about all these existing resources and the needed resources that families have. So thinking about the whole Wise County landscape here, where are those opportunities for collaboration to share or provide those resources, either with each other as serving organizations or with families? So where are those opportunities for collaboration? And then to extend that question, then who else in the county, what other organizations need to be at the table to improve children's health? So where are those opportunities for collaboration, and who else needs to be involved? And Jamie,
I'll share a little bit on this. So opportunities for collaboration for providing and sharing resources at the Wise Health System. Their ECHO group meets on a monthly basis, and then partners can share about what resources they need. And so that gives us an opportunity to see where we can provide some resources. And then also at the coalition meetings, we have the community time where everybody can share. And so I'm seeing Kim's comment, the faith communities and getting those involved. I think that would be great to get them involved in some of the meetings.
Kim also mentioned about wanting to involve city leadership. And I think, again, that speaks to there's a lot of different municipalities in Wise County. I'm sure everyone works across together, but doing what's going to be best for their local community or local city. But how do we bring those leaders together for some of these larger county-wide efforts that are happening? So where else is this collaboration already happening? Nicole, you mentioned chambers of commerce.
Yeah, I'm just wondering, I mean, they're such, connectors, and they spread information and share information. And so I just wonder maybe what role they could play in distributing some of that health information that families need to know about. Just seems like they would be a great partner.
Mm-hmm. And Heather, I don't know if you would like to unmute and share a little bit about the ECHO group. We've been talking about ECHO all this time without really spelling out the acronym and what that group is charged with working on, but we know you guys have a big imprint in the community.
Sure. So ECHO, or our executive council, it was originally the Wise County Health Forum. And in 2018, when we started Healthy Wise County, we kind of took over the Health Forum and made it our kind of executive council. And we have 3 other committees focused on mental health and substance abuse, healthy living, and community resource. So when y'all are talking about these, I'm like, hold on, wait, I have some resources around this. Let me get you some flyers and some information. So that ECHO committee comes together and we go over what is happening in each of those committees, but also it's a time for each of the community members, organizations, whoever, to say, hey, here's what's going on with us. Here's, we're having this event, this is going on, we have this resource, everything like that. So that's kind of a time for that. And then I take all that and put it in our Healthy Wise County newsletter. So We have about 125 or so people signed up for that newsletter. So all of those resources, that information, everything like that goes into that newsletter so that everyone has access to it whenever they need it. And if anyone would like to join that committee, it's not like it's less of a working committee and more of a here's resource kind of committee. Or we've even had where, hey, I'm having this issue. Do y'all know someone who could help with that? So if y'all would like to join, just let me know and I'd be happy to send y'all the meeting invites and everything.
That's great. And Heather, you can, if you're comfortable, you can put your contact information in the chat. Or I know several of us right now are making a note to follow up with you after today, because like I said earlier, we're going to be able to capture everything from the chat, and we'll want to share that back out with everybody following the summit so that you all can see or have your own little list of the things that we've discussed and the resources mentioned here, so that you all can follow up as it applies to you. So I will stop here and thank all of you for engaging in this conversation and putting your responses in the chat as well. This has been really helpful as we try to, make sense of the data that Blair shared and applying it to what that looks like in Wise County in real life. So you guys have done a great job in helping to create that picture for everybody. I will turn it over to Lauren to close us out, but thank you all again.
Yes, thank you, Courtney, and thank you all for sharing your thoughts and comments today. I think we had a really great discussion, and so I'm excited to see kind of where these conversations can lead and getting those resources out into the community. So before we officially close out, we'd like to invite you all to complete a quick survey for us. The QR code is on the screen there, and then there's a link that will be provided in the chat for you all. But we really just want to know how we did, and it'll be helped. Your feedback will help to plan future events in the future. So I'll go ahead and pause here so that way everyone can complete that, and then we'll close this out. Okay, I'm looking around at some folks, and it looks like everyone's wrapping up. So again, I'd just like to thank you all for your support of the Coalition and the Center for Children's Health. Everyone plays such an important role in improving the health of Wise County children every day. You can find more information related to the Center for Children's Health and the Coalition and our data resources on the Center for Children's Health webpage. You can also contact Jamie Josephson. Her email is there on the screen to learn how to get involved with the Coalition. And then also Blair mentioned the data dashboard, and it's available to the public and contains a lot of great information related to children's health in our region and specific to Wise County. So if you have any questions about today's presentation, please feel free to email chna-feedback@cookchildrens.org. And again, thank you all for spending your time with us today at our Wise County Child Health Summit. Have a great afternoon.